Doctors, nothing allowed me more in my private practice to adjudicate or adjust my treatment plans than an excessive motion test. Today at Spinal Kinetics, we call that a CRMA, computerized radiographic mensuration analysis. It's a measurement analysis for excessive motion. It tells you where and how bad the non-disc ligaments are damaged. And these non-disc ligaments that cause spinal instability or excessive motion that causes a nerve problem or a pain problem at that joint, which is what a spinal instability is one of the most important tests you can do in the whole spinal injury market, right? It's one of the most important tests. Now, some people say, well, you're biased. You're biased because you're the CEO, because you helped develop the AI that helps to auto-detect these injuries and the system that Spinal Kinetics uses. You're all about this excessive motion testing. I'm all about the excessive motion testing because I want to actually help the market to standardize spinal injury workups. Spinal injuries are pretty simple. There's only 3 ways you can damage the spine. You can break it, or you can damage the ligaments. Ligament damage is 2 imaging biomarkers: excessive motion for the non-disc ligament and herniation on MRI for the disc ligament injury. So that's the only ways that you can actually damage the spine, right? But you sit there and say, well, okay, well, how does this help me? I have a lot of doctors say, well, how does this help me? How does this help me with my care? Okay, I always look and I say, well, wait a second. If you knew how damaged something was, how could it not help you in care? I mean, of course, the more damaged something is, the more care it requires. Now, that's a change in treatment plan. As simple as that sounds, that's a major change in treatment plan. Right? So in chiropractic, if I need 3 times a week for 4 weeks, that's a treatment plan. But if I need it for 8 weeks or I need it for 12 weeks, that's a treatment plan change. Okay, so just the amount of care that I might deliver is a treatment plan change. How I deliver the care is a treatment plan change. Maybe I want to do manual adjusting. Maybe I want to do some other form of adjusting. Maybe I want to use ultrasound, but I got to have a rationale for using ultrasound. Maybe I want to use Softwave, but I got to have a rationale for using it. Maybe I want to use a Softwave for 12 visits, for 15 visits. I got to have rationale. What am I doing? Why am I doing it? See, somebody on the other side that's trying to figure out, should I pay you or shouldn't I pay you, has got to understand what it is that you're doing. So if your documentation, let's say you're a medical doctor and your document, I'm just going to use this analogy, your patient comes in with they got into an auto accident and they have a scratch on the arm. Okay, and it's like, well, 2 butterfly pieces of tape will handle that. Yeah, you could charge for your evaluation and you could charge for the butterflies, right? But let's say that you had the patient come back 6 times and you did all kinds of stitches, but you didn't have an injury that was justifying that level of care. You're not going to get paid, right? And you may even get attacked for overutilization or for trying to create some sort of insurance fraud, right? So when an insurer looks at your care, I don't care what your care is. I don't care what the care costs. I don't care if you're the highest person in the market today. I don't care. Your documentation has to support what you're doing. And so that's a treatment plan phenomena that all diagnostics give you. If you have a disc herniation, yes, then you're using decompression. Good. Let's say you have a really bad disc herniation. The worse the disc herniation, the more treatment you may need to do with the decompression table. So that's how this changes your treatment plan. It doesn't have to be that significant, but I want you to really understand that those are changes to your treatment plan. Let's say that you have an upper cervical ligament injury. The upper cervical ligament injury mimics every symptom of a mild traumatic brain injury, just about every single one of them, right? But it can dictate in the care plan that you want to test to see if you've got a traumatic brain injury or not. Or you may want to make a referral. Your documentation dictates, and your excessive motion test dictates that you may have a facet injury, that you may need some help with. It's not stabilizing, so you need to refer out for pain management, or you need to refer out for a surgical consult. But everything has to make sense based on what your imaging says and what your documentation says. If that doesn't make sense, then you will have issues with your care plan not getting reimbursed. So all I want you to see is that The imaging drives everything you're going to do care plan wise, because you can't determine how badly injured the spine is without the imaging. And anybody that's trying to talk you out of imaging, trying to talk you out of excessive motion testing, is basically trying to talk you out of having documentation that supports the level of care that you might be delivering. Those always, if you're under documenting, you are going to be under reimbursed. And there's no way around that. So you want to use the highest level of diagnostics. You want to find the best diagnostic providers that you can find, and you want to use them. And remember, if you're trying to do this yourself, you're looked at as biased. If you're trying to do an excessive motion study yourself, you're looked at as biased. And you have to remember, there's a lot of people across the country that are doing really not so good at stuff with excessive motion testing. In other words, they're having somebody at front desk, somebody that hired 12, 14 bucks an hour, plotting points, doing the studies. Nightmare, absolute nightmare in deposition. I do a lot of deposition training with doctors, not to get them to have tricks in deposition, but to get them to feel comfortable in deposition. All you have to do in deposition is tell the truth. And if you don't have a hard time telling the truth, depositions are going to be pretty easy for you. But it's the imaging that drives the care. It's the imaging that drives every single decision you're going to make. So you don't want to be deficient in the imaging itself. I hope that helps.